Hello and welcome to 12 to Your Health. I'm your host, Dr. Derek Da Silva. Diabetes has become an epidemic in this country with tens of millions of adults and children living with the disease. While there are some risk factors we cannot avoid, there are others we certainly can. Joining me is Dr. Anne Marie Van Hoven, an endocrinologist at St. Peter's University Hospital's Thyroid and Diabetes Center in New Brunswick. Thank you very much for joining us today.
Thank you for having me.
So type 1, type 2 diabetes, what's the difference?
Well, the difference is a big difference, actually. Type 1 is typically in younger people, and it's usually an autoimmune phenomenon where the pancreas stops making insulin. So it doesn't have so much to do with overweight and obesity and things like that. It's just a phenomenon where those patients need to take insulin in order to survive. Type 2 is drastically different. It occurs usually in older populations and has more to do with insulin resistance and the consequences of that.
How big is type 2 diabetes in this country, and particularly here in New Jersey?
It's very big, and it's getting bigger, which is really the overwhelming problem. It's probably about 8% of the population has type 2 diabetes at this point in time, and that is going to skyrocket over the next decades.
Why? Why do we think that this is going to skyrocket? Do we know?
Well, unfortunately, we do believe that it mirrors the obesity epidemic in this country in terms of that, as people get bigger and as their lifestyles really just become less healthy, with less exercise, less physical activity, more weight, and poor nutrition, it's going to get worse before it gets better.
So from there, let's go right to some of the risk factors that we have. And, we have risk factors. We know what the risk factors are. But, for me, the most obvious ones, as you said, seem to be weight and inactivity. Would you comment on those two?
Yes, that's absolutely true. So I sort of like to look at it as modifiable and non-modifiable risk factors. You certainly cannot change your genes, and in many ways diabetes is a genetic disease. So if you are part of an ethnic population that has a higher percentage of diabetes, well, then that's that. You certainly can't help from getting older. However, you can be healthier. And I think that's the message to people, that they can lose some weight, they can change some of the ways that they eat, what they eat, and their level of physical activity, and really modify the course of this disease.
One of the things that I really focus on with my patients that are diabetic is the importance of activity. Can you comment on that again? Because people will take their medicine, they'll watch their diet, their hemoglobin A1Cs don't change. And before we go there, can you comment on what hemoglobin A1C is very quickly, please?
Yes, that's a great question. The hemoglobin A1C is the marker of diabetes. So it is essentially a 3-month average glucose. So it's the window into your treatment overall for a 3-month period of time. Your hemoglobin A1C, if you have diabetes, should definitely be less than 7%. And every patient should know what that is and what theirs is, because it is the marker of your control.
Okay. Let's talk. Go ahead. You were going to finish something else.
No, so I just was going to move on to the exercise part of the equation here. There are so many studies that show that exercise is beneficial. And also a point that I'd like to bring out is that diabetes is a progressive disease. So what you can initially manage by almost doing nothing, to making minor changes in your diet and your routine, to then requiring medicine, and then ultimately, if you live long enough, which is the whole point of all of this, even requiring insulin. The only thing that we have that modifies that progression is weight loss and exercise.
That is unbelievable. What about testing? How often should people test, and when should they test?
So if you check your finger stick, it really depends on your medication regimen, to be honest. If you're on insulin, you probably need to check your sugar 3 or 4 times a day, because you can adjust that insulin depending on your sugar. If you're on pills, on oral agents, then it's probably reasonable to do it once or twice a day. But I always like my patients to change the times they check. In other words, not get stuck in a rut, just check it once in the morning and then forget about it the rest of the day. So much of this disease is paying attention, that if you can check at different times, figure out how different foods affect your sugar, you'll get more knowledge and you'll benefit from that.
Diabetes is thought to be and I hate to use this word, but it's a reality, a fat person's disease. Is it?
Well, It is
I
definitely...
mean, with the obesity issue, it seems to be.
It is accentuated by being overweight, yes, because people who are bigger have a tendency towards diabetes. However, it is genetically based. There are plenty of people who are very overweight who don't have diabetes. So it's not the only thing, but it's something that increases it in a given person, as well as lack of exercise. And I want to just mention that since you brought it up, which is over the almost 10 years that I've been doing this, it has seemed to me that people have started to think living is exercising. Exercise is really exercise.
Right.
Getting your heart rate up, breaking a sweat, doing it because it's good for your body. It's not walking and taking one flight of stairs instead of the elevator. It's not parking 2 parking spots away from the door. It's actually exercise. And that's what people need to do and kind of realize.
I am so glad you mentioned that, because that is so important. Sustained heart rate for a sustained period of time.
Exactly.
Thank you very much for joining us.
Thank you.
Ahead on 12th Day Health, why you should consider becoming an organ donor. And later, why holiday weight gain is about more than just food and what you can do to stop it. But first, your health bite of the week. Here are 3 great reasons you should be taking a probiotic.